I'm delighted you're here with us today to speak with these two fabulous authors and eminent psychiatrists, Dr. Carlin Barnes and Dr. Marquita Wills, authors of the new book, Understanding Mental Illness, a comprehensive guide to mental health disorders for family and friends. So let's get started telling me a little bit about your backgrounds, each of you, and what led you to choose the field of psychiatry as your profession. Carlin, let me hear from you first.
Great, thank you for that question, Susan. So my name's Dr. Carlin Barnes. I'm originally from New Jersey, and I currently reside in Houston where I have a practice. I decided to go into psychiatry. It was a bit of a journey. I always knew I wanted to be a doctor, was encouraged from a very early age to kind of pursue a field in medicine, a career in medicine. But along the way, what intrigued me the most through college and being a psychology major was kind of the inner workings of the mind and why people act the way they do and how the mind works and how we can impact that as physicians. When I became a resident in medical school, a lot of my most interesting clinical experiences were in psychiatry. And as I continued on, I really saw that mental illness plagues everyone, but faces that look like mine and people of color in particular were often overlooked. So it really fueled a passion that I had to kind of pursue the field of psychiatry and to go on and to become a psychiatrist in clinical practice, and also to think creatively about how I could get my voice out there to impact others.
Thank you. And that is what you have done in this book.
Thank you.
And Marquita, what about you?
So very similar to Carlin Barnes, I always knew that I wanted to be a physician. I too was encouraged at a young age to pursue medicine, but I had no idea which specialty I would ultimately end up in. For me, it came down to emergency medicine and psychiatry. Those were the two fields of medicine that I enjoyed the most as a medical student going through my rotations in my third and fourth year of medical school. And I ultimately decided to go with psychiatry because I realized I looked at the clock differently. For emergency medicine, I would look at the clock and I'd be like, oh, okay, 2 more hours until my shift is over. But when I looked at the clock when I was doing psychiatry, it was like, oh my gosh, I only have 2 more hours left in my day. So I was just totally absorbed. It felt more like a calling than it did work. And I knew that that was a field for me. I loved helping people. I loved getting to know people. I loved getting to know what made them, motivated them. And so that personal relationship that I was able to develop with my patients in a deep, meaningful way is ultimately what made me choose psychiatry as a field.
Oh, thank you for sharing that. And that comes through loud and clear in this book. That very
Thank
connection.
you.
So now that we've had a chance to learn more about each of you, can you tell us a little bit about how you came together to join forces in the book? And also, what was it that made you decide to write a book like this?
Sure, you want to tackle that first?
Sure. So Marquita and I were colleagues. We worked at the same company, and actually out of an organic conversation, one day after a long day at the office, we said, we both have a lot of experience. We both had excellent residencies at Harvard and trained, and we've both done different things throughout our career, but we really wanted to come together to reach the masses. We have local spheres of influence. For myself, I said, well, I sit behind a desk and I talk to my patients, and those are very meaningful experiences, but I really feel like there's a larger audience that really could be helped by what we could do together. And so we said, Marquita actually said, let's write a book. And I said, Marquita, we're both very busy. How are we going to get that done? But we did it. And so I think that, we've had a lot of time that we've spent on this. It really, you can tell that we're both passionate about it, because along the way, it never felt like work. It felt like we're very hopeful that this work that we're creating will do just that, reach the masses and empower people to live healthier, better lives.
I love that story. What about you, Marquita?
Absolutely. So I think for us, we realized that so much about mental illness is talked about in secret. and talked about behind closed doors. There's a lot of misinformation. There's a lot of mythology, really, around mental illness. And so what we wanted to do was spark healthy conversations and ignite healthy conversations around mental illness and mental health, and what that can mean for society at large. And so that was one of the reasons why we decided to join forces and write this book. We thought, hey, we're informed. You know, we've spent a lot of our time talking about it, and there are a lot of people out there who just don't have that information. So let's get out there and share this information with people, because quite frankly, there's a public health crisis around mental health and mental illness issues, and we wanted to be part of the solution.
So I'm really glad that you brought that up, a little bit about the context of the public health crisis. Both of you have been on the front lines of seeing that in your clinical work. And also in the work you're doing in the corporate arena. So let's hear a little bit more about how important this is for the average American. Maybe you're not someone who personally has been affected by it, but the question is, why should you care?
Absolutely. Well, when people think of public health and public health approaches to illness, I think the first thing that often comes to mind is contagions and outbreaks and things like that. But I'd like to offer an alternative model of thinking about public health. When we think about issues that affect our society, mental health is truly one of them. We've got a large portion of our homeless population who are mentally ill. We have a large portion of our incarcerated population who are mentally ill. And so we have mass shootings that impact others, and oftentimes people who commit mass shootings are mentally ill. And so these impact all of our day-to-day lives, but even bringing it more to the person. Mental illness occurs in probably 30% of the population, so that's someone's loved one, someone's child, neighbor, coworker, church member, friend, who may be suffering from this. So it impacts us all, and we need to think about how to arm people with information as opposed to disinformation about the issues, so that we can all lead healthier lives and our society can be improved.
So one of the things that occurred to me when I was reading your manuscript had to do with this idea of stigma, and is one of the reasons that there is so much stigma in your assessment because of the lack of information in the wide swath of the population. What are your thoughts on that, Carmen?
Well, that's a great question. There's a lot of shame associated with mental illness when you don't know what it is. And so with the information that we give you, our readers, you'll be able to say, well, this is something that is a medical illness or a medical condition that I can go and get help for. Because the statistics show us 1 in 5 Americans every year will suffer from this mental illness. And if you talk about a serious mental illness, that number increases to 1 in 25. And when you talk about lost productivity and what the cost is on an annual basis in the US, it's $193 billion from lost productivity because someone is not able to go to work or to not be a breadwinner for their family. And so these statistics bear fruit that this is an issue that affects us all as a nation, as families, as individuals. But if you don't know, then you don't know. And so if you don't know, that feeds the stigma, because there's not information out there to get people to get the help that they need. In fact, studies show that almost half, 40% of mental illnesses arise in childhood, which is near and dear to my heart as a child psychiatrist. But if a child is living with a mental health condition, that early intervention can treat and put them on a different trajectory and have a better outcome and better prognosis, then they'll be able to lead healthier lives, have healthier families, and to impact in healthier neighborhoods. So it affects us all.
Thank you for that. So in reading your manuscript, you pose a very simple yet important question to your audience in the introduction. And the question is, why read this book? Why is it important that everyone consider this book part of being a good citizen?
Absolutely. Thank you for asking that question. We think knowledge is power. getting the opportunity to learn about this issue really empowers all of us as citizens to be able to then take action and do something about it. We try to provide tools, resources, and strategies for families, friends, and loved ones to be able to help their loved one who may be suffering from a mental illness get the help that they deserve. And so we believe that we tried to write the book in as accessible language as we possibly could. So we tried to stay away from medical jargon and technical terms to make it digestible and easily absorbed by as many people as we could, because we think this information needs to get out there. We also think that empathy is critical. The idea of having information takes away that stigma, takes away that shame, and allows people to be empathetic towards their loved one who may be struggling with simple tasks like getting out of bed or brushing their teeth. And oftentimes people just can't quite conceive. They say to themselves, well, I've been sad and I got over it. How come you can't? And so this gives them an opportunity to say, well, wait a minute. They're going through something different from what I went through, and I need to have empathy to be able to care for my loved one in a way that they deserve to be cared for.
I'm so glad you brought up that part about empathy, because that's one of the critical skills that's lacking in so many areas of life, and particularly in this arena around mental illness. It's very difficult for loved ones to maintain a high level of empathy. And my hope would be that your book would be a wonderful starting point to getting people to see that that is what your loved one needs most from you. They need empathy. They need to feel that you're still connected to them, even with what they're going through.
Yeah, and Marquita said it best earlier on in our conversation, to spark, why read the book? To spark conversations, to start discussions. And I think it's a great time in our country, because we're talking about things that we, in previous years, in previous times, maybe put under the table or didn't feel comfortable speaking about. And mental health and mental illness is one of the conversations that we really need to start having at the dinner table, on the news, in the media, reading books like this. I just heard the other day that Oprah Winfrey and is it Prince Harry? I think Prince Harry are coming together to make a docuseries on mental illness. And so, it needs to be a part of the regular conversation and repeated. It's something that we hear on the news, a suicide. Well, it doesn't end there. The story doesn't end there. There are ripple effects. And so if you have information that we lay out in our book, you can begin to have regular discussions.
That was one of the statistics that astonished me, was the percentage of suicide rates in young people. So I think it was, you said, the leading cause of death in 25 to 34-year-olds? Or
It's the second leading cause
of death. So what are some of the conditions that folks are struggling with that you detail in your book to give people this education and the information that they need to be helpful to their loved ones? Marquita.
Thank you for asking that question. Carla and I thought a lot about this when we were writing the book. We wanted to think about what disorders impact the most Americans. So the first two that we came up with were really wanting to get out there about anxiety and then also mood disorders. So anxiety and depression are the two most common disorders that happen, and those are the disorders that we spend the most time in at the beginning of the book. And this is an interesting topic because anxiety and sadness are something that we all experience and we all feel. So then how is it that, it goes from just being anxious to then having an anxiety disorder? Or you go from just being sad to actually having a diagnosable condition of depression. And that's something that we talk a lot about in the book, the difference between having feelings and emotions and then having a disorder where your feelings and emotions sort of get out of whack. And so that's one of the things that you might find in the book, is how to distinguish between those and how you might know that it's time to go and get a loved one help.
That's one of the things that struck me so much when I read the manuscript, was the ability to understand the distinction between what is sad or what is anxious and what is a clinical challenge that needs to be addressed. And I think that's where a lot of folks miss the boat on getting help. They don't assess that they're in a place.
Right,
What are your thoughts on that, Carlin? What's your experience?
With the lack of getting information out there and lack of getting help, it's a real issue. I mean, we talk about health literacy and, you know, what to ask your doctor and what information you're getting from your health care clinician. And one thing, I think the trend is improving. I've been really encouraged to know that my primary care colleagues, and oftentimes I'll in fact get referrals from pediatrician and primary care doctors who've done a questionnaire screening for depression, or you may go in a waiting room and there's literature about anxiety disorders and depressive disorders. And so that's encouraging, but I think even a more grassroots local approach is really great. I was attending my place of faith and worship last Sunday, and my church is partnered with NAMI, which is the acronym for the National Alliance for Mental Illness, where every Wednesday you can drop in and learn about depression and learn about anxiety conditions, and it's free of cost. And you know, they're really pushing the message that we need to get more information to people, to get people the help that they need, because a lot of people are really in pain and hurting. And you know, you see it every day when you turn on the news in our society. And so the push is out there, the trend is swinging into a positive place, but I just hope it continues, because this is an issue that is a public health crisis. A lot of things that people are dealing with that they don't know that they're even dealing with to get help.
So as authors, you take an interesting approach in your book. You provide readers with patient vignettes, little mini case histories that are real life examples of how living with some of the challenging behaviors and the symptoms that people experience can really affect someone's life. Are there particular conditions or arenas that have impacted you as psychiatrists? Carlin?
You know, that's a great question, and it's really, every time I go to my practice, I could write a book about an encounter. And some days it's trying, but it's always rewarding. My office manager tells me, she calls me Dr. B. Dr. B, this is your calling. I know I think the last week when I was at my practice, I've been treating a 5-year-old girl now for autism. And when she first came to see me, no one had even said, and this was about 2 years ago, so say she was 3, that she had, or she may have, an autistic disorder. And so got mom the resources as far as therapies, and started the little girl on medication, and she's now in early intervention school program. And she went from tearing my office up literally on every visit to playing quietly and watching videos. You don't even know she's in the waiting room, and she's speaking now, and she has friends, and she loves her little girly dresses with the tutus. And so it's stories like those that really make me want to reach a larger audience, and really was part of my motivation for wanting to write this book. I know I saw an adult patient last week, and she said, I'd been waiting for 6 months to see you. Had gone through Hurricane Harvey in Houston, lost her father, lost her uncle, and is clinically depressed and on short-term disability. But she said, you know, I really know I need to get treatment and help. And so I was committed to keep this appointment, because it's important to me that I get back to living my life. And I hear those stories all of the time.
Wow. What about you, Marquita?
I know for me, my area of specialty that I just love is I love working with patients who have schizophrenia, schizoaffective disorder, or bipolar disorder, which are the psychotic disorders. I just feel like it's just fascinating to me how the mind works. And so I'm always touched by I have so much empathy for people. Life is hard, period. Whether you have a mental illness or you don't, life is hard. And so when people have that extra layer, I just have that much more compassion and empathy for them navigating through life, and having connections with others, and building those connections and bonds with others. I know sometimes people who have schizophrenia, other people tend to not want to connect with them. But for me, those are the people that I love to help the most.
There are several chapters in your book that are relevant to public health and mental health and social crises that are facing our nation. You give some statistics in the book, and you talk about the significance, the staggering incidence of some of these public health and social crises. Could you highlight each of you, perhaps one that was really a standout for you as you were doing this research for the book, perhaps surprised you? Marquita.
So I think for me, we talked about this a little bit earlier. The homelessness issue is really one that strikes a chord in my heart. Somewhere around 30 to 40% of our homeless population suffer from a mental illness. And it just doesn't seem fair to me that people in our society who are vulnerable and need the help that they need are left to fend for themselves out on the streets, literally. Just imagine if everyone with high blood pressure lived on the street. We wouldn't do that in our society. We wouldn't allow that to happen. And so giving people the dignity of having a home just because they have a mental illness is the one thing that for me touches me. So that was one statistic that really struck home for me.
And that we see every day in most of our American cities, every day, unfortunately. And what about you, Carlin?
For me, I think it would be suicide. You know, in researching and combing through literature for our book, it really surprised me. I mean, I hear it as a psychiatrist and I know it being trained, but the incidence of suicide is a really big issue. As we spoke earlier, suicide is the second leading cause of death in adolescents, age 15 to 24. And recent studies have shown that for children, the rates of suicide are twice as high now for African American youth than their counterparts. I think that there's been a lot of recent information in the press about suicides. For example, I think just recently I heard that there were some youths who had, a couple of youths, adolescents, who had taken their lives following the mass shootings in their high schools. And so I think that schools are doing a great job in, making teens and even children, unfortunately, we have to start that young, more aware about suicide and public high school public assemblies in elementary school, but just that it really pains me to know that our youth in particular are having so many problems, bullying and domestic violence, that they're ending their lives. Suicide, as we know, is a final answer, so is final for a temporary problem. And so to get the message out there that there's help, not only for the youth or the teenager, but the families and the parents, it's really important. And that's one thing that really struck me as we were kind of writing this book together.
And it's so timely, as you said now, because some of the survivors of the shootings are now, as you know, here in Florida, even 1 year later, are now taking their own lives, which is just so unbelievably tragic. So I think the message of this book is going to be even more important as we see the impacts carrying on long beyond the shock of the event, but well into the future of the people who were impacted. They're going to need this information. What messages do you hope that readers will take away from this?
So, for me, coming out from the stigma and the shame, recognizing that this impacts all people, all walks of life, all races, all religions, all ethnicities, mental illness is real. And so that's one key message. I think another message is of recovery, resiliency, and hope, that these are treatable conditions. Therapies, medications exist, and we know a lot in science. And so you don't have to suffer alone. Families don't have to suffer alone. they can get help, turn a corner, and lead productive lives. And I've got so many stories of individuals who have gone and sought treatment and who have lived good, productive lives after having gone through crisis points with mental illness. And I think another key message is one that we touched on earlier, and that's just having empathy for those who may be struggling. So those are some of the things that we really wanted to kind of let shine through in the book. Anything else, Carlin?
Great points, Marquita. I think one additional point is that we talked earlier about, if you don't know, you don't know. But if you have the information and the knowledge, then you can begin to take measures to get help. But I also want I want you to know that mental health treatment is for everyone. I think that there's a myth or fallacy out there that you have to be super rich or super knowledgeable and to be able to access mental health or mental health care or therapy. However, our book is a great place to start. Grassroots community resources are great places to start. And a key takeaway is in our appendix section. We provide several resources that offer very cost-effective and affordable resources for people, family members, loved ones who may be living with someone who's living with a mental health condition. So treatment is out there. You don't have to be super rich. You don't have to know someone who knows someone. It's available for you.
Hope. What a great way to end our conversation. Thank you so much for sharing your time with us today and giving us an opportunity to get an insight into this exciting and important new book that's coming out in September.
Thank you.
Where can readers find this book when they're ready to go?
We are directing people to our website. Carlin and I have a website. It's at www.healthymindmds.com. HealthyMindMDs.com. And if you go there, you'll have more information on where you can find the book.
Fantastic.
Our book will be released by our publisher September 3rd, 2019. We will start taking pre-sale orders very soon. That information can be found on our website, HealthyMindMDs.com. And you can also follow us on social media, HealthyMindMDs.com on Facebook, Instagram, and Twitter.
Wow, lots of ways to connect and start the conversation. Thank you so much.
You're welcome.